Hi there. Thank you for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic. And remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. We are very interested and very happy to hear from you, so please don't be shy. Feel free to send your questions, feel free to send your comments, and we will try our best to respond to those concerns. As usual, I'm starting off today by wearing my mask that covers both my nose and mouth. This is the correct way to wear the mask. Any other way is not the proper way. And when it's time to take it off, we use the straps that are around our ears to take it off. I will take mine off for the remainder of this conversation so that we can continue to have very clear communication. We are now in 2021, in the third week of January, and I want to take a moment to look again at our numbers in Guyana as it relates to the COVID-19 pandemic. Right now, we have 6,908 patients who were tested positive for COVID-19. Of those 6,908, unfortunately, we had 170 patients died. Those are COVID positive patients who would have died. That gives us what is called a case fatality rate of 2.46%. This is coming down, it's going in the right direction, and we're very happy for that. We had started out somewhere about 7 or 8%, and we continue to have a better case fatality rate the longer we go into this pandemic. We have had 6,165 persons who are considered recovered from COVID-19 infection, and that gives us a recovery rate of almost 90%. And that is standard and in keeping with the numbers and statistics across the world. It is important to analyze our own outcomes as it relates to COVID-19 mortality and morbidity, and know where we stand in the world. If we are better, we want to analyze why. If we are worse, we want to analyze why. We want to make sure that whatever we do, we ensure the best outcomes for our patients in Guyana. At the time of this presentation being prepared, we had 3 patients in the COVID ICU at Liliendal. All of these patients were adults. I believe overnight another one was transferred in from a regional hospital, so that makes it 4. Of these patients, 2 are intubated. Intubation means that there is a machine that is breathing for them. And if you've ever seen an ICU, you would know that that's not a pleasant sight to behold, but it's sometimes very necessary. We put patients on the ventilator so that enough oxygen could reach their lungs and their tissue, and therefore their body can continue its normal functions, which is highly dependent on the supply of oxygen. A lot of patients who are on the ventilator will need to be heavily sedated and paralyzed, because if they wake up and they start to fight against the ventilator, that will be counterproductive for what we are hoping to achieve. They will fight against the ventilator, and that will actually cause more harm than good. We have 1 person who is on CPAP, which is continuous positive airway pressure. So that's a mask that is worn over the face, and it continuously pumps high pressure oxygen into the lungs to keep the lungs properly aerated. We have no persons in the transition ward, and this is generally due to the fact that we have the capacity now to get very early results. We have the antigen testing that is available so that as persons are suspected of having COVID-19, we can run a test and we can find out within 90 minutes if this person has an active infection, and that is a major development. What that has done is it has helped us tremendously to clear the congestion and backlogs of those persons we are uncertain of. Persons may come in or used to come in a lot of times when they have suspected COVID, and when you do their tests, you have to keep them in a particular area called the transition area until the results come back. In times gone by, that used to take sometimes 3, 4, up to 7 days, and that used to cause tremendous strain and stress on the healthcare system. So we're very happy to be at this stage right now where we can have results back in 90 minutes so that we can make definitive decisions in managing these patients. It is also very encouraging to note that in the ICU and transition area for COVID, we have no children at this time, and that is very encouraging. If we look at the daily new cases in Guyana, we can see something very interesting. This would have peaked in September, October, and it started to decline thereafter. But as we got to late December and early January, we are starting to see the graph go up again with the number of new daily cases now about 40 to 50 cases per day. And that is a concern that we have to guard against, because it's important that we recognize this, because what happens after the number of positive cases is that there is usually a correlation that follows that we are now going to expect more patients being admitted into hospital and possibly into the ICU. So the healthcare system is bracing and preparing for that possibility. Hopefully it doesn't happen, but we have to still be prepared. This is likely due to all of the social activities and interactions that persons would have had over the Christmas holidays, whether it's shopping, whether it's family get-togethers, whatever activity persons would have been involved in. Once there is close human contact, there is a potential for spread from person to person. So we have to be cognizant of that fact and prepare ourselves accordingly. The number of active cases, again, shows the same pattern, where we have had a peak in September, October, and it was starting to fall, and now we are seeing the number of active cases increasing again, where it's over 500 active cases. Since the pandemic touched down in Guyana, we had a low in December where our number of active cases was just about 250, but that has since doubled in the first 2 weeks of January 2021. So usually when cases start to spike, countries take protective measures, and especially when the healthcare system becomes overburdened or at the risk of being overrun by sick patients, the step that is taken most often is something called a lockdown. And if you look at what happened around the world during the lockdown, it has affected a large number of persons. In India, for example, there was 1.38 billion persons who are still in some kind of lockdown. At the peak of the infection or the outbreak, China had 760 million persons who were in lockdown. At various stages, the US would have had almost 300 million persons in lockdown, and other countries as well, like Bangladesh, Russia, and the Philippines, have all had over 100 million persons affected by the lockdown. The next thing to understand is, why do we have these measures, these public health measures? Now, if you understand that every healthcare system in the world has a capacity, what we are trying to do is to prevent the capacity of every healthcare system, and in this case it's Guyana, from being overrun by too many sick persons coming to hospital too rapidly. So we're trying to spread these cases throughout a time period that can allow the healthcare system to cope. Because if you overrun and overwhelm the healthcare system, there will be a collapse, and that can lead to catastrophe. Not only will it affect the COVID-19 patients, but all other persons who are seeking medical attention in the hospital from all other causes, whether it's renal failure, whether it's heart failure, whether it's accidents, cancers, etc. Everyone suffers if the healthcare system is overrun and overwhelmed by these sick patients. The next thing we need to understand is the various risk levels that are involved in arriving at the point where you would do a lockdown. In the UK, for example, they derived a very easily understood scale, which is color-coded from green to red, and with red being the most dangerous. And, you know, when there is a risk of healthcare services being overwhelmed, that is code red. That's when they begin lockdown. And the least threatening or the least dangerous of the lot is when they anticipate that COVID-19 will no longer be a threat. At that point, they will have routine activities, traveling, whether it's by aircraft, by boat, by trains, etc. That point of complete eradication, we do not have any country yet who can completely claim that they have reached that stage. So right now we are still in a pandemic where the entire world is actually affected. So we still need to maintain all kinds of caution, maybe not the full lockdown, but certainly the social distancing, certainly routine sanitation, washing of hands, and wearing of masks. It is very important to follow those basic, simple, practical guidelines to reduce your risk as well as the risk for those around you. When we talk about lockdown, it is also important to understand what are the practical considerations that are needed. It is all well and good to call for lockdown if your fridge is full and your pantry is full, you have internet and you can watch Netflix and, you know, basically have something to do or work from home. But for the majority of people around the world, this is not a reality. When you say stay at home, a lot of people have challenges of staying at home and wondering how are they going to eat? How are they going to provide for their families? So what may work well for one population may not work well for another population. And if we were to look at what was studied in a country similar to ours, like in Mozambique, they specifically devised some criteria that we must satisfy when going into a lockdown. And these include access to safe drinking water, and I would add food in the home, adequate sanitation in the home, having a source of reliable energy, that is very important, access to information or communication technology, especially children needing to do online schooling or parents needing to work from home, and having a permanent source of income or having sufficient savings to meet your needs. Now, that is something we can apply to Guyana to know if we can really satisfy these conditions before we are able to enact across the board a lockdown that affects everyone in the population. And if we look at the same Mozambique, the prevalence of people meeting these prerequisites or criteria for lockdown, we can see that most of the time this criteria is met more often in the urban areas rather than rural areas. And that is something that we need to bear in mind here in Guyana as well, because the people, for example, in Georgetown and the cities may be much better off to meet these criteria rather than those who are in the countryside. A national lockdown generally means that you should stay at home, you should work from home if possible, you should only leave home for work, volunteering, or medical care. Meet with people only in your support bubble. Those are people who are close to you, that you know their activities, etc. But you must also maintain some level of exercise and physical activity that should be done outdoors alone or with one other person. So I hope this would shed some light on two things: our local situation as well as the considerations to be in place for any potential lockdown. Remember, if you have any questions, feel free to send us a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining me. Bye-bye.